Hello, everyone, and welcome to our program tonight, a conversation with Dr. Mangal about loneliness in adults, a very timely and topical item to be discussing. So my name is Shireen Ash. I'm a librarian at the Corte Madera Library, and I'm very, very pleased you are here tonight, and I'm very pleased to be presenting this presentation to you. So just a little bit of information before we get started. We are recording this. The recording is typically available within 2 weeks up on our YouTube website. That's the Marin County Free Library YouTube channel. If you have any questions, you of course can email me about that. And I'm going to ask everyone to please stay muted throughout the presentation. If you have questions, and there will be time for questions, we encourage questions, please put them in the chat and I will read them out at the end for Dr. Mangal to answer them. So now a bit about our presenter. Dr. Paul Mangal is a licensed clinical psychologist. He works in private practice in the Bay Area and even in Marin County. He completed his academic training at the University of Florida, Emory University School of Medicine, San Francisco VA Healthcare System, and University of California, San Francisco. He has expertise in brain health and wellness, and he specializes in neuropsychological assessment and cognitive rehabilitation. He does therapy for adults with a variety of neuromedical diseases and disorders, and he's very generously offered to talk to us tonight on loneliness. So with that, it's all yours. I will disappear and see everyone for questions at the end of your presentation.
All right. Well, hello, everyone, and welcome. I hope everyone's staying warm out there. I know I get cold as a Californian anytime the temperature drops below 60 degrees. So wearing my puffer jacket tonight, and I'm excited to talk about loneliness tonight, which can be a difficult topic to think about and touch on, but I'm going to have plenty of practical tips and strategies towards the end as we do our talk today. So with that, I'll get started, and just wanted to let everyone know that I have no conflicts of interest or major disclosures, and that I do work in private practice in the Bay Area. So to start us off, I want to give a little bit of an outline of what I hope to achieve and cover today. And so my main focus of this talk is going to be in loneliness in adults and also older adults, who I think are a special population who deserve some extra and special attention. And we could go on as well about children, and they deserve their own talk. So I'm really going to be focused on strategies for adults. One of my hopes is to provide some education and to improve some awareness about loneliness and social isolation and what those things are, what they mean. And overall, it is a little bit of a difficult topic to think about and can have some serious health consequences. And so I really do want to stay positive overall. And like I mentioned, we'll be talking about some practical tips, some things to think about and consider as ways to help manage loneliness in if it's either something you experience or even in loved ones or friends or neighbors that you have. So this is the general outline for today. So let's get started. And I want to start off by defining loneliness. So loneliness can actually be divided into two different concepts. The first one is social isolation. And this is when you look at the number of social contacts somebody has. This relates to having objectively few relationships or contacts, or having infrequent contact with those individuals that we might be connected to. And so that includes thinking about our social networks, so partners, friends, family members, and it's really the number of social connections that we have. Now, social isolation does not always lead to loneliness. Loneliness, in contrast, is that painful feeling or that experience of having poorer social connections than you want, or feeling like you don't have a lot of people out there. And so these things can be separated because social isolation does not always lead to loneliness, but it can. Loneliness is something that is perceived, meaning that there's no objective marker for how many relationships we should have. But loneliness comes into play when there are fewer social connections than we want. And that is different for everyone. So some people may have a partner and just a few friends, and they feel like they've got a lot of social support. But other people, while they may have many friends, they may have noticed that their network is shrinking. And so as a result, they have an experience of loneliness. And when we talk about social support, this is that feeling of being cared for or having assistance that's available to you, whether that's emotional support, informational support, companionship, and tangible and intangible resources, like having someone to come over and help you out with a problem in the home, or just providing some companionship and support. So those are two major concepts we'll be talking about today: loneliness and social isolation. Now, why is this so important? I think this is something that's really important to think about and talk about, because loneliness is actually a public health concern. And what that means is there can be negative consequences to our health, our physical health, our cognitive health, and our mental health when people experience loneliness. So about a quarter of adults over 65 are considered to be socially isolated, meaning that they have fewer relationships and contacts. And this is something that may happen as we have more birthdays, that our social networks can contract. And for those who are, for about a third of individuals over 45 and about 43% of those over 60, they actually have the experience of feeling lonely. And there are certainly some negative consequences to experiencing loneliness, like I've touched on. So there can be an increased risk for all-cause mortality, an increased risk for mental health issues. So things like depression, anxiety, even having suicidal thoughts can increase when people are feeling lonely. Not only does it affect our mental health, but loneliness can cause cardiovascular health problems, like an increase in heart disease and strokes, an increased risk of dementia, and an increased risk for hospitalization and even going to the ER. And what we find is that it's really the sustained and chronic loneliness that people experience that really jeopardizes mental and physical health the most. So when there is a prolonged period, kind of what can happen, over the pandemic, as we saw, that this is something that is important to address when loneliness persists for a longer period. To talk a little bit more about older adults specifically, and thinking about something like the risk for dementia, I wanted to share some information from a study that is a meta-analysis. And what that means is the authors looked at a lot of different studies and put them all together. And then they were able to look at that data. And when they included all of these different studies together, they had about 2 million people in the sample. And then they looked to see at what the risk for dementia was in those people thinking about loneliness and social engagement. And they found that for those people who had poor social engagement, that this increased their risk for dementia. And just to define dementia, that's when people have cognitive problems that interfere with their ability to take care of themselves independently. And so for those who had a small social network, or they feel that they did not have this social support, even for people who were unmarried and who did not have a partnership, they found that the risk for dementia increased by 41%. They also found that there were some factors that were protective against dementia, which includes having good social engagement, being married. People who have a partner are less likely to develop dementia, having more social contacts, so more individuals to talk to, and having a higher level of social activity, so doing more things. And this decreased the risk of dementia by somewhere from 20 to 40%. So we can see that as people have more birthdays, maintaining social engagement is very important when we think about this risk to cognitive decline. And in fact, what we see is that social isolation and loneliness can directly affect some cognitive functions. So it can affect how quickly we process information, our memory abilities, and also something called executive functions, kind of like the CEO in the brain, things like planning, problem solving, organization. And so what this means is that social activity is actually very stimulating for your brain because you have to listen to others, you have to think about what they're saying, have a good response. And so it can really help to maintain our cognitive function when we engage in social activity. That's one of the top recommendations I make for my patients when I do neuropsych evaluations together. One of the reasons that loneliness can affect our cognitive function is because of the stress that it causes. So when people feel lonely, it can actually be a stressor that you experience. And so, for instance, cortisol and adrenaline, the hormones related to stress, increase when we feel lonely. And it can also affect sleep and affect inflammation in the body. When we have poor sleep or chronic inflammation, then this can affect our cognitive function. Additionally, I was talking about the importance of social activity. What we found is that when people engage in social activity, it actually causes new neurons to be created in their brain. And it also causes the connections between those neurons to strengthen. So social activity is not only good for our emotional health, but there's actually a biological underpinning to it, meaning it actually changes the way our brain works. To talk a little bit more about mental wellness, loneliness can be associated with depression, but it's something that is distinct from depression. And so what that means is that they're two concepts and they can be connected, but they're not always connected. So for example, in a study that looked at 8,000 older adults, it found that 53 had symptoms of depression, but only 18% of those people were lonely. So you can be lonely, but not be depressed. and you can be depressed, but be socially connected. And so it doesn't always, there isn't always a direct relationship here, but they can certainly be linked. And another thing that we can see is when people experience symptoms of depression, it can cause them to withdraw socially. So there is that relationship between depression and loneliness as well. Other studies have also linked loneliness to anxiety and having suicidal thoughts. And so the reason I'm mentioning this is because I'm a mental health provider, and our mental health is extremely important to talk about and to think about, and especially in the context of loneliness. Now, I wanted to spend a little time talking about those specific factors in our society, in our culture, that can influence the experience of loneliness. So these are things that might increase or decrease your chances of experiencing loneliness. The first one is really thinking about social networks. An extensive social network is not required to feel connected to others. Like I had mentioned, people who are in partnerships often feel a greater sense of connectedness, and that is just one other person. So your relationship status can influence your experience of loneliness, and those who are unmarried, who are widowed or divorced, they might have some extra risk and might need to take some extra steps to make sure that they're connected. Additionally, caregivers, so people who are taking care of others in their life, may be at extra risk. Those who are caregivers can sometimes feel separated from their family or friends, or feel lonely because of the challenges that they experience in caring for others and the challenges that they face, which can really feel isolating. Now, the presence of pets can be something that's protective. Animals, pets, having dogs, cats, or other kinds of pets can help us feel like there's, some emotional connection that we have. And so whether or not you have animals can also be a factor that might influence how connected or how lonely you feel. And definitely, if it's something that you're interested in or that you're able to do, having a pet can be really beneficial for your emotional health. Certainly, individuals who are experiencing grief or bereavement are at additional risk for experiencing loneliness, because the loss of somebody who's important in your social network can change the way that you feel connected. Certainly, aspects of our health can also put you at extra risk. People who have illnesses, poor health, or disability are at extra risk for experiencing loneliness. The status of your employment and whether or not you might be in school is also another factor that can contribute to how connected you feel. And a lot of people experience a big change when they transition from employment to retirement. And even though you're retired, it still means that you need to have some things on your plate, that there are things that you need to do. You might want to replace that employment activity with other kinds of activities like hobbies or volunteer work. Certainly, the presence of religious or spiritual organizations can be very protective, because there's a natural social network that's often built into those kinds of organizations. Transportation can also influence loneliness. So when people lose their independence or if because of where they live or their geographic location, there's not a lot of transportation or connection, this can influence the way that people experience social connection. And certainly, certain aspects of living, like in a retirement community, in a residential care or a nursing home, can be both protective and isolating in a way. So often I've heard from my patients that they actually really like living in a senior living facility because they have made more friends and made new connections. And then finally, I wanted to talk about those people who are marginalized in our society. So I already touched on those who experience disability or illness or poor health, but those who are from another country or another culture, who have a different racial, ethnic background, or sexual identity or orientation, can experience extra risks because anybody who might experience discrimination may be at extra risk for experiencing loneliness. So I think this is important because the idea of social isolation is not just about how many people you know. There are all of these other cultural and societal factors that interact with our experience of social engagement. And one final thing I wanted to touch on before we get into some more practical and positive tips is to think a little bit about the pandemic. Everybody's favorite subject at this point. I'm sure we all want to hear more about this, but I thought I would just touch on this subject because, of course, there's been an extra stressor on all of us over the last couple of years. And according to the American Psychological Association, the pandemic did lead to an increase in loneliness worldwide, especially for high and upper middle income countries. And while 5% may not sound that much, that is millions and potentially hundreds of millions of people who have begun to experience loneliness where they didn't experience it before. Part of the reason for this is the lockdowns, the physical distancing, and having to go remote in terms of work and school, or even losing jobs. And older individuals are particularly at risk, especially those people who don't have access to the internet, which has become a major connection point over the pandemic. And so what we really like to push through is to maintain social distancing, or something we thought about more in the past, but to not be isolated. So while you can maintain distance, but you don't have to be isolated. So I know that we just spent some time talking about all of these negative things to think about, but it's really important to acknowledge that loneliness is something that's serious and important. And it's not something that we should just brush off or just think, oh, it's not a big deal. If there are people in your life that are lonely, or if you're feeling lonely, I want to encourage you to think about ways to change that. And that's going to be the next part of this talk, which is thinking about some practical tips and some practical considerations about how to start to address loneliness. So let's think a bit more about that. What are these practical tips and the ways to stay more connected? So the first thing I want to recommend is to think about what kinds of barriers might be causing loneliness. And we'll start with health barriers. It's not an exhaustive list, but these are some things that might inch people towards becoming more isolated. So the first thing to think about is to treat sensory issues. So related to our senses, like our vision, or our hearing. Many people, as they have more birthdays, they may experience hearing loss or some trouble with their hearing. And what happens when we can't hear people in conversation? Well, then we have less desire to engage in the conversation, or we might even feel embarrassed or ashamed that we can't really hear, or that you have to ask someone to repeat themselves. And so for a lot of people, they may choose to kind of hang back. And I want to encourage people who have hearing loss to see if they can get that addressed. And I know, or I've heard, that hearing aids are not always the most comfortable, but it's certainly important to be able to hear. Similarly, having some visual difficulties, like for instance, cataracts that are not treated, can affect our ability to transport ourselves or to see. And so both of these kinds of sensory considerations are important to address in order to minimize the impact they might have on our tendency to become more isolated. And what we also know from the literature is that hearing loss is a risk factor for cognitive decline. So that's another reason to think about ways to treat hearing loss and the reasons it's important. Mobility, your gait, and your balance can also be a bit of a barrier. So if people have trouble with their mobility, it might affect their ability to go out into the world and do things. And so whatever can be done to help increase mobility is important to think about. So is it possible to use a cane or a walker? Or if you're disabled and you can't walk, is there a possibility of getting a wheelchair? These are all really important to help maintain independence and to maintain mobility. It's also important to think about mental health and mental wellness and to treat any issues that people are experiencing. So depression, as we touched on, can cause people to feel or to want to withdraw socially. Anxiety and panic can cause people to avoid social situations. And for instance, I've heard that as people have spent more time alone over the pandemic, considering socializing brings some anxiety for them and may cause them to avoid social engagement because now they're a little bit more used to being alone or just interacting with a few people. So thinking about whether or not you yourself or people in your life are experiencing troubles with their mental health, it's really important to make sure you're treating any underlying symptoms so that people feel able and more willing to engage in social activity. And there are a lot of treatments, including therapy, support groups, and medications. And I think sometimes people feel shame surrounding loneliness. And I want to encourage people to understand that this is very normal, that people may feel lonely. And I want to encourage people to reach out, not only to other people in your life, but maybe to consider talking to your doctor or your therapist to mention loneliness and see if they have recommendations. Another thing I want to touch on is transportation. So if you lose access to transportation, or for instance, you're no longer able to drive yourself somewhere, this can really affect your social engagement and your ability to manage loneliness. So what I've put on here are some resources for people to consider regarding transportation. Just solving one of these barriers might be able to help you stay more connected. So for instance, You might be able to do an evaluation at the DMV if your license has been taken away for whatever reason, and that might help you retain your independence. If you're not able to stay driving independently, there are a lot of other resources. Maybe you can find or identify some family or friends who would be willing to give you transportation. If you're able to, you could consider public transportation. There's also taxis or rideshare services like Lyft and Uber. And especially for seniors, there may be extra discounts for using Uber. So for instance, a lot of local senior centers can set you up with an Uber account through Uber Health. And as a result, they might be able to help get you rides for free or at a discounted rate. And similarly, Lyft has a program called Lyft Up for people with disabilities or seniors, and they offer discounted rates for ordering Ubers. So if you if you've got a smartphone and you can do that, then this might be an option for you. Of course, a taxi is an option. And if you have family members with an Uber app, they've made it easy so that you can order an Uber for somebody else and it will send them that information. So for instance, it'll send you that information in a text message. And then you're still able to take these rides, even if you don't necessarily have the program or the app yourself. And because, a lot of this audience is in Marin, I also wanted to provide some specific resources for Marin County. So first of all, in any county, their aging and adult services center or division can help with connecting people to some of these transportation resources. And if you look on the County of Aging and Adult Services website, or even Marin Transit, there are a lot of options for people who can't, drive themselves somewhere independently. So there's Vivalon Rides, for example, that has a lot of different programs like a volunteer driver program where they provide free transportation for those over 65, and also things like non-emergency medical transportation or shuttle services for groups. And certainly Marin Transit also has a lot of options. There's the paratransit service for those with disabilities. There are fare assistance programs for people who are low income or on Medi-Cal. And there are also volunteer programs and other reimbursement services. So some of these programs can also provide some reimbursement for your friends or neighbors who provide rides. And this Catch a Ride program can offer up to 10 discounted taxi rides per month. So there are a lot of options for people, and I wanted to spend some time thinking about this because transportation doesn't always have to be a barrier, although sometimes it can pose a big barrier. Now, let's think about how to get more connected. It's really important to think about those relationships that are out there that you might be able to leverage. So of course, if we have a partner or a romantic relationship, that is a big source of support. But that's not the only source of support that people have. You can think about family members, some siblings, aunts or uncles, parents, if you still have them, children, nieces and nephews. There are a lot of family members that people may have access to think about their connections with others. You can also think about your friendships, old and new. Maybe there's somebody from the past that you've lost contact with, or that you talk to infrequently that you might be able to call up and, reforge a connection. I think that I know from my life when there are people I've lost contact with who reach out to me, that it can be a very rewarding and interesting experience to think about these people that you've actually met maybe decades ago. And of course, there's always new friends that can be made. And we'll talk about different outlets and different ways to find new friendships. Neighbors are, of course, one built-in source of relationships. So you might consider reaching out to a neighbor or introducing yourself to those around you if you don't know them. We touched on pets, but our relationships with our animals are still relationships, and they can be really rewarding and really supportive. And then thinking about community support. So are there organizations out there that are religious, or your local library, for example, as all of you have found, youth centers, a YMCA, a community center, cafes or restaurants, other types of residential communities like apartment complexes, parks. Are there volunteer groups or other shared interest groups where you might be able to leverage some relationships? And of course, there are also the professional healthcare relationships that you might have. So your relationship with your doctor or your therapist, care coordinators, case managers, these are still relationships and can be a source of support. So I want everyone to think a little bit about, if they're feeling lonely, where are those sources of relationships that they can turn to or think about? Now, what about tools? So we've thought about some people that you might be able to be connected to. What tools can you use? Kind of organize them from less fulfilling to more fulfilling. So I think we're all familiar with social media, for instance, Facebook or the messaging on Facebook. That can be one way to connect with people from afar. And of course, messaging through one of these websites or through text messages can be one way to stay connected, although it doesn't provide the most amount of connection. A phone call is a little bit better. Having a chance to really get to talk to someone over the phone can be a way to keep you feeling connected. In the pandemic times, we all have gotten more familiar with Zoom, like right now, and FaceTime or other video conferencing platforms. And if you're not too tired of them yet, they can be a great way to stay connected to someone afar, because it's nice to see somebody's face and to also talk with them at the same time. Of course, having a face-to-face meeting can be the most fulfilling. I think we all enjoy meeting each other face-to-face over, some of these other tools, although these other tools can still be really helpful. Other ways to increase your social activity includes group outings and trips, or participating in other kinds of organized activities like classes, or other kinds of group activities. So let's talk about some more practical tips. And these are practical tips from the National Institute on Aging. So to kind of combine some of these things that I've been touching on in the past couple of slides. So of course, connecting with family and friends is one of the best ways to decrease your loneliness. So think about nurturing and strengthening those existing relationships that you have with your family members or your friends, giving them a call, scheduling a time each day to connect with somebody different, or even scheduling some time to go visit someone. You might be able to play cards or play other games with your family, your grandchildren, your neighbors, other residents of your living facility, and this can be a lot of fun. For those who are able to, they may consider joining a group to go on a trip. So a lot of senior centers offer some group trips where they provide, like a charter transportation and take people out together to experience something in nature, like a hike or to visit a national park. So always another way to think about increasing your social contact. You can video chat with your family and friends. You can think about new restaurants or cafes that you could consider going out to, or new places to try. You can consider sharing music, going to concerts, engaging in live music, or even making music together. And other hobby groups can be helpful for connection. Like, is there something that you've wanted to try, like new skill or a new hobby, bird watching, painting? Is there a class at a local community college or a senior center or even the library where you might be able to take some of these courses? And are there ways to leverage your old relationships, like friends from high school or college, by connecting with your alumni associations? Now, thinking about other ways to stay connected, you can try to do something new. Picking up new interests and new hobbies is a great way to meet new people or to do some fun activity with people you already know. Is there a cooking class that you're interested in? Have you ever made sushi before? Is there some kind of art, language class, technology class that you might be interested in? Again, community colleges and libraries may offer free or discounted courses for older adults. Might be a great way to get connected. Is there a book club you could join or a film club? Is there some new physical activity class that you might try, like yoga or Tai Chi? Could you take on a new instrument or dust off an old instrument that you already know and play that? And my mom actually started playing the flute again when she retired, and she found a community where she does some recitals with some others and takes lessons. So I've been really happy to hear that she's connected in that activity. And also thinking about going to a museum or doing some kind of tour or educational program to connect with others and do something fun. You might also want to think about how you can get more connected to your community. I know that we've touched on community centers or senior centers, but is there some way for you to increase your participation through one of these organizations? Even volunteering can help us meet new people and can also be very rewarding. So serving meals, organizing some kind of drive or clothing donation, collecting food, all of these things can be great activities. If you're able to, volunteering to help others with limited mobility or limited access to transportation, joining a new place of worship or a committee. If there's a homeowners association where you live, can you join their community? Or can you otherwise volunteer at a school or a hospital or with animals? Some other ways to increase your activity and connection with the community. Is there a garden or a park you can join? Cleanup services through a local recreation center, playing in a band. joining a choir, joining a theater troupe. For some people, they might even consider getting a part-time job. That might be another way to increase your connection. And again, thinking about hobbies and interests, maybe if you have some skills in one area, teaching these skills to other people, like teaching them embroidery or sharing your interest in birding with those around you. And it's important that you're doing things that relieve your stress and take you out into the community. So I really want to encourage people to be active, not only as a way to meet other people, but as a way to take care of mental wellness. So gardening is great physical activity. Of course, an exercise class or taking walks, going dancing, doing something like bowling, bicycling, swimming, playing with family members, grandchildren, dancing, going on nature trails. All of these physical activities can help get us out there into the community and increase the connection we have with others. And then additionally, thinking about your mental wellness, because we touched on the link between loneliness and mental health, it's important to do things that are helping relieve your stress. Cognitively stimulating activities like reading, practicing mindfulness or meditation, doing activities like Tai Chi, Qigong, yoga, physical activities that we touched on before. These are all great ways to take care of your mental wellness. Important to cook yourself healthy meals or to seek out healthy meals and make sure that you have nutrition. And then, of course, always considering touching base with a professional if you could use additional support. So a therapist or a counselor or even your primary care physician. So I've given a lot of general tips, and I hope that some of these things are inspiring and help you think about different ways that you can get more connected and that you can stay more connected to others. And so with that, those are all the major topics that I wanted to discuss. And I thought that we could open it up in the last 9 or 10 minutes or so and take some questions that people have been posting. So thanks very much for attending the talk.
Well, and thank you. It was a very, very comprehensive talk. You left no stone unturned. So I really appreciate that, as I'm sure everyone else does. So we have some questions and a lot of comments. So I will start with the first question, which you touched on. Perhaps you can elaborate a little bit on could you differentiate between loneliness and deep grief or loss?
Yes, that is a great question. So grief is the sadness that we feel when we lose somebody, when we lose an important relationship in our life. We often mourn that loss. And I like to think of it as a reflection of how much importance and how much love there was in that particular relationship. And so when you lose that support, people experience grief and bereavement. And sometimes that can cause loneliness, but I do think that they're different concepts. So people can experience grief and not feel lonely, but they can also be linked together. So if, for instance, you lose a partner and that partner was a main source of connection for you to others, then you may experience both grief and loneliness. And so I think that they can be related, but they are two different concepts. And loneliness is, again, that painful feeling of feeling that you don't have social connections.
Thank you. That was really helpful. It was very, very clear. And now some comments that really relate closely to the things that you mentioned. One of our listeners is deaf, and without her cochlear implant, she finds it harder to connect to people, which I think is exactly the point. It illustrates the point you were making. The next point is that depression can really play into the connection with people. And this listener observes that she's learned that she really has to intervene quickly when feeling depressed, so it does not become a bigger impairment to or obstacle to making connections.
Absolutely. And that's very brave. It's really important to not sweep these issues under the rug. And it can be hard to talk about our mental health, but it's really important. So I want to commend you for noticing that, whoever that may be in the audience, and for thinking about that.
Well, and she really went on to echo that by saying depression is a brain issue, not a negative issue. So very focused on, it's just a health issue that needs to be treated like any other health issue.
Absolutely.
And we have a couple of suggestions. I'll just echo them in case people aren't reading the chats. Just that Marin Villages is a great organization for older adults. They help seniors remain at home. They help with home tasks, and they have groups and meetings. So you can, I think there might be some fees involved. I was a little more familiar with them earlier, but we can find out about them for you, or of course you can research it. But they have volunteers who will help, maybe drive you to appointments or help you with small things in the home. So that's a really great resource. And someone also mentions goodfairy.org. So that's goodfairy.org. And volunteers help with rides or shopping, and it can be a single time or more ongoing. And someone notes what you also said, that just volunteering to help someone else also brings one out of isolation. And I don't know if you want to make a comment. I'm just trying to get everything in before our time runs out. But the county has a senior peer counseling program where people visit on a weekly basis. And apparently the ride service, Vivalon, has a connection where someone can phone you on a regular basis. So thank you very much, everyone. There's a few more, but I really want to appreciate you sharing the resources here.
Yeah, I'm taking notes too here.
Yeah. I think you can copy the chat. Meetup.com has many groups to join on Zoom or in person. And someone mentions there's a knitting group that a friend is in through the Mill Valley Rec Center. And I happen to know they used to, at least pre-COVID, have a Mahjong group that was very popular. Larkspur has a senior walking group from 9 to 10 a.m. on Monday, Wednesday, and Friday. So you get your exercise and your social connection all in one. And let me just see. Those were all the comments. There is a request from a listener who would ask if you would be willing to share your slides. Oh, that's very kind. Okay, so you could email them to me, and then if you're interested, maybe as a PDF, it's a little bit smaller file, and I could share them out. So you could email me at sash@marincounty.org. I'll just put my email in the chat. And again, we will be posting the whole presentation with the slides and Dr. Mangal's wonderful presentation on our YouTube channel within 2 weeks. So that's, you can get the whole package there, but if you really want to go through the slides and take notes, we'll send them out to you as well. Thank you. That's very generous.
Absolutely. Definitely happy to share. And, if anybody has specific questions for me, my email is also up there on the screen. Please feel free to reach out to me.
That's also very generous. So just before we end for the night, do we have any more questions? We have like 2 minutes left. Your program and presentation was so thorough, no one has any more questions. So we're getting some very nice thank yous, great summary of opportunities. I echo that entirely. It was very, very thorough, very complete. So I want to thank you all for joining us, and thank you especially Dr. Mangal for sharing your knowledge and your experience about this. It is a difficult topic, as one listener commented, and it's really important that we address it. And I thought you did in the best way possible. So thank you very much. And I hope everyone has a joyful evening.
Thanks everyone for joining. Take
All
care.
right,
Have a good
everyone.
evening.
All right, you all too. Bye-bye.